Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Thank you for viewing today's episode of Dr. Ozello Sports Medicine Report. Today I'm going to cover Iliotibial Band Syndrome. Iliotibial Band Syndrome is a common overuse/overtraining injury. This injury can occur in all types of athletes, but is most common in walkers, runners, jumpers, sprinters, cyclists, weightlifters, basketball players, volleyball players, and even bowlers. So this is a common overuse injury. The pain is on the outside or lateral part of the knee, hip, and can even be in the thigh. The pain is right over the iliotibial band. The iliotibial band is also known as the iliotibial tract. The iliotibial band is a long piece of strong fibrous tissue. It's basically connective tissue. It's almost like a giant ligament. It originates on the ilium, on the lateral part of the ilium, which is part of the pelvis, and goes all the way down the thigh and attaches to the side of the tibia. The tibia is the big bone in the lower leg. That's where the name iliotibial band comes from. The iliotibial band has several different functions, but the main thing that it does, it helps to stabilize the hip and the knee. It also assists in several motions, including flexion of the knee and abduction of the hip. Iliotibial band syndrome is an overtraining injury. If you have seen any of my other videos of Dr. Ozello Sports Medicine Report where I speak about overtraining or overuse injuries, you know that I always say there are three characteristics or three factors, three contributing factors that cause an overuse injury. Number one is too much training. Number two is inadequate rest between training sessions. And number three is some type of biomechanical fault. Number one and number two are extrinsic sources, meaning that they are outside the body and things that we can control. Number three is intrinsic. It's inside the body. So it is something that is occurring there or something that is present. It may be a strength imbalance. It may be a muscle weakness. It may be an incorrect movement pattern that is contributing to this injury. And that biomechanical fault causes either pain or symptoms in that area or pain or symptoms in another area because that area has to take a greater workload. In iliotibial band syndrome, what happens is the iliotibial band becomes extremely tight and it starts to place pressure on the outside part of the thigh, especially at the bony prominence of the thigh. So usually the pain is felt on the outside part of the knee, right above the knee, above one of the bony prominences, and then in the hip or the upper part of the thigh. That's usually where the pain begins, and then it can be felt throughout the entire thigh if it continues to progress. Now, the biomechanical faults of iliotibial band syndrome, there can be a couple different things. Okay, there can be a weakness in the foot muscles where someone is hyperpronated. There can also be weakness in the gluteal muscles. Because what happens is, especially the gluteus medius muscle functions to help to stabilize the pelvis. If we are weak in the gluteus medius muscle, when we are running and when we are walking, the pelvis moves up and down too much, and it places a greater demand on the iliotibial band. Therefore, the iliotibial band starts to get tight. And it's the same thing if the hyperpronation is the source of the symptoms. There is an increased demand on the iliotibial band. There can also be other biomechanical faults present, such as just overall general core weakness, weakness in the abdominal area, weakness in the pelvis, but the gluteus medius muscle is one of the most common, and also the weakness in the foot muscles where the hyperpronation is common. Other factors that can contribute to the formation of iliotibial band syndrome include running on an uneven surface. If you think about it, when we're running on the road, most roads, most streets are banked, meaning that they're a little bit higher in the middle and then they sink down like this. For safety reasons, we are always instructed to run against traffic so the oncoming traffic can see us. So what happens is the left leg is always on the lower side of the street. And also, if there is some type of banked road where you're running on a track where one side is a little bit lower than the other side and you're constantly going in the same direction, the same thing can happen. It creates an increased demand on that iliotibial band and contributes to the development of iliotibial band syndrome. Another extrinsic contributing factor for iliotibial band syndrome is the way that we run. Many people will overstride, meaning that they take too long of strides. And this happens a lot if someone is running with a partner who is taller than them. So the shorter person takes longer strides to keep up or keep pace with the taller person, even if they're walking. And this is a mistake. Instead of taking longer strides, instead of overstriding, you want to just speed up your normal length strides, because when we overstride, it places an increased demand on the iliotibial band. So you want to use faster normal length strides. Now is the time for the disclaimer. The disclaimer is extremely important because I want all of you to know, please do not try to self-diagnose yourself. If you have any type of symptoms that you think is iliotibial band or any other type of condition, please see a doctor of chiropractic or another type of medical professional, specifically one that specializes in sports injuries. Iliotibial band syndrome is a condition with an insidious onset. It comes on slow, and a lot of times people don't quite understand what it is, and it gets progressively worse. So you want to make sure that you see a medical professional, get a proper evaluation, get the proper diagnosis, and the proper treatment. Do not hesitate. Do not think that this will go away. Even if the pain lessens, the source of those symptoms is most likely still there. So please do yourself a big favor and see a medical professional. Viewing this video does not take the place of seeing a medical professional. So please see a medical professional if you believe you have iliotibial band syndrome. Another contributing factor, an intrinsic contributing factor, biomechanical fault that I failed to mention earlier, and I apologize for that, is weakness in the inside part, or medical terminology, what we call the medial part. The medial part of the thigh and the medial quadriceps. Weakness in that area can contribute to iliotibial band syndrome. Because what happens is it places an increased demand on the outside part of the thigh. So you want to make sure that that area is nice and strong, that your medial thigh, the medial quadricep area is very strong. Prevention, prevention, prevention. I'm going to say it one more time. Prevention. Prevention is easier, faster, and less expensive than injury rehabilitation. So do everything you can to prevent iliotibial band syndrome. And if you have had iliotibial band syndrome in the past, do everything you can to prevent a recurrence. Iliotibial band syndrome is a condition that develops, and it takes a long time for it to develop. The symptoms usually begin insidiously. There's no trauma involved with it. You just start to feel those symptoms, and then as you're out running, especially if you're running up and down an incline, or if you're running stairs, or if you're on a banked surface, or even if you're trail running, those symptoms can kick in, and those symptoms will progressively get worse. So please do everything you can to prevent this condition. You want to strengthen your feet and that will help to prevent hyperpronation. So strengthen the muscles that support the medial longitudinal arch of the foot, and strengthen the muscles that support and move the forefoot. I have a video, a foot strengthening exercise video in Dr. Ozello Sports Medicine Report that I will attach a link to this video at the end so you can watch that and learn those exercises. Also, strengthen your gluteus medius. Extremely important. If the gluteus medius is strong, then the pelvis is going to stay in a stable position. There will not be an excessive amount of motion in the pelvis when you are running. This way, the demand on the iliotibial band will be normal. It will not be too much. Also, strengthen the medial thigh, strengthen the medial quadricep, strengthen the groin muscles, and strengthen the medial hamstrings. This will help you a great deal. If you do these three things, it will help you a great deal to prevent iliotibial band syndrome. Also, you want to develop a running or training program, competitive program, where you are giving yourself adequate rest between training sessions. Please start or restart your training at your current level. Do not start at what you were at before you stopped training, or before you got injured, or what you used to do 5 years ago, or what your training partner is at, or what you used to do when you were in high school or college. Please start your training at your current fitness level and increase in gradual increments. Also, make sure that you give yourself adequate rest between training sessions. During those rest days, do your active recovery, and if you need to, do passive recovery. You can stretch the outside part of the thigh. Now, the iliotibial band really has very few, if any, stretch receptors. So if you are stretching the outside part of the thigh, usually you are feeling the muscles that are right next, you're feeling stretch in the muscles that are right next to or underneath the iliotibial band. So you want to be very mindful of that. Also, you can foam roll the outside part of the thigh, but you have to be very careful when you're doing that. You want to make sure that you're not going over the bony prominences that the iliotibial band goes over. So you can stretch the outside part of the thigh and you can foam roll the outside part of the thigh, but you want to make sure that you target very specific areas. That will also help you. And then if you throw in strengthening the medial thigh and the foot strengthening exercises and the gluteus medius exercises, plus your training that you're doing, make sure you warm up, make sure you cool down. All those are key to preventing iliotibial band syndrome. If symptoms of iliotibial band syndrome should occur, get to the doctor of chiropractic or get to another type of medical professional that specializes in sports injuries. Do yourself a favor. Like I said before, do not try to self-diagnose yourself. If you've had this before and you know exactly what it is, then get to the doctor immediately. Do not hesitate. Get your professional care. As a doctor of chiropractic, I have seen this condition in my office, and honestly, I have suffered from this condition myself. And this condition sucks. Okay, I hate to sound like that, but this is a very tough condition to deal with. So you want to make sure that you get treatment immediately. Get chiropractic care to help get the proper nerve flow to all the muscles in the pelvis and in the thigh and in the lower leg, and it will help to restore the skeletal motion in those areas. So you will make sure that everything is moving correctly. So please do yourself a big favor and get professional care. See a doctor of chiropractic if you think that you have this condition, or if you know that you have this condition. It will help to lead you on your path to recovery. Do not hesitate to start your self-treatment immediately. Once you get the proper diagnosis, start your self-treatment immediately. With the self-treatment, it's basically the same things that I described when I talked about prevention, but you always want to work through a pain-free range of motion. You never want to do any type of exercise that evokes symptoms or intensifies any of your symptoms, or that causes symptoms in another area. You want to be very mindful of how your body feels. Listen to your body's signals. That is extremely important in injury prevention, but especially in injury recovery. Listen to what your body's telling you. If an exercise, a stretch, a strengthening exercise, a motion exercise doesn't quite feel right, then you need to modify that exercise or skip that exercise and move on to something else. So you want to start your self-treatment immediately. Do your stretching exercises, do your foam rolling, do your strengthening exercises. Move through a pain-free range of motion, and it's going to help you to recover from iliotibial band syndrome. Thank you, everybody, for watching today's episode of Dr. Ozello's Sports Medicine Report. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Please feel free to like this video. Also, please feel free to subscribe to my YouTube page, Dr. Donald A. Ozello DC. If you have any questions, feedback, or suggestions, please leave them in the comment section below. You can visit my website, championshipchiropractic.com, where you can get additional information on the book, and you can connect with me on other social media platforms. Iliotibial Band Syndrome is a chapter in the book. It's chapter 10, starts on page 64. It's covered much more in depth than I can actually cover on this video. So please check out the book. It's available in ebook and in paperback. But I want to say thank you to you for viewing today's episode. I greatly appreciate it. Again, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. And always remember, train hard, train smart, utilize nutritional resources that work for you, stay injury-free, and accomplish your goals.